Good afternoon. I'm David Sweat, and welcome to the Shelby County and City of Memphis Joint Task Force briefing for September the 15th. And welcome, we will be joined today in the briefing by Mr. Mauricio Calvo from Latino Memphis, and also from Dr. Bruce Randolph, our local health officer. And we'll be happy to take questions after the remarks. To bring you up to date on where we stand, we've had 29,330 cases reported so far in the COVID-19 epidemic here in Shelby County. We've also had 424 deaths. Yesterday, we had 213 new cases reported on September the 14th. And what's important about that is we've had several days recently when we had fewer than 100 cases reported per day. And on average, over the last week, we've averaged 121 new cases reported per day. But that 213 obviously represents a larger number, and it occurred about 1 week after the Labor Day weekend. We've also seen the reproductive rate of the virus increase in recent days, and right now the reproductive rate, some people call it R0, is at 0.94. Meaning that each person who is infected is creating 0.94 or almost one additional case. We've been below 1 for more than a month and going back into late July actually. And to see the RT rate or reproductive rate of the virus climbing back to 1 is something that would be a cause of concern. We don't know if it's a trend. We know it's a single data point at this point, and we will continue to monitor that all week long. And in other news, we'll make a brief mention. There's been some reporting today about some changes with the ability of us, of the health department, to tell you about all the tests that are being performed in the county, and that has increased the number of test results that we are able to analyze. I wanted to talk about how that change occurred and why it's a good thing. What we learned from our data team talking to the Tennessee Department of Health data team is that for the past few months, the testing numbers that the state was providing to us daily for us to analyze were pre-deduplicated. And that's a good thing from one point of view because it helps us answer very quickly how many people have been tested. By taking out the duplicates, we were able to very quickly say how many positives, how many negatives, and get an overall case positivity rate. But to pre-deduplicate the data before they provided us for analysis meant that we were not seeing the full picture of testing in Shelby County. That includes the routine testing by nursing home partners, healthcare systems, other individuals who are being tested multiple times, not just a single time. And when we were able to get access to the full range of test data, it did add quite a number of tests to our data stream. And that, the importance to the data team at the health department is that we now have a fuller understanding of all the testing that's going on by all partners, and we will be able in the future to talk about 2 different positivity rates. One would be the case positivity rate. Of all those individuals who have tested, what fraction or percentage of those tested positive at some point in time? The other rate would be the testing rate, positivity rate concerning all tests, and that would include even the duplicate tests that people have routinely over time if that occurs. That's a bigger number, and it does represent the full range of all the testing that's going on. And so in the future, you'll see both rates. One will be communicated as a case positivity rate. The other is a test positivity rate. They will be slightly different, but it's a better understanding and a more complete picture of testing in Shelby County. Now, I do want to mention just what I can mention at this point in time, because it is an ongoing investigation with a lot of media interest, is we can confirm the Shelby County Health Department is working with the University of Memphis to investigate clusters of transmission at the university. One of those clusters does include the football team, and staff members associated with the football team. But there are actually 2 clusters at the University of Memphis, plus we've identified sporadic cases that on our investigation don't connect to either of the clusters. So we will be continuing to investigate that over the next several days. But at this point in time, we can confirm that there are 36 cases among students and staff at the University of Memphis that are under investigation. Now, I mentioned testing, and one of the things that Dr. Haushalter has mentioned in prior briefings is that the COVID response unit would be going out into the community and organizing some test events, and we have 2 such events this weekend. And I'm going to invite to the podium now Mr. Mauricio Calvo from Latino Memphis to talk about these 2 events that we have planned this weekend. One will be occurring at Iglesia Ascension on Rammel Road, and the other will be on Jefferson Avenue at Sacred Heart. And welcome now, Mr. Calvo.
Thank you, Doctor. Well, good afternoon. Well, good morning, and happy Hispanic Heritage Month. Today marks the beginning of Hispanic Heritage Month, and what better way to celebrate than by taking care of all people in Shelby County. So I'm going to be making my remarks in English first and then Spanish. I don't know if you'll be able to do the Spanish part in sign language, but we'll just have to live with that. So, you know, as we heard before, the Health Department, in an effort to reach all communities, will be hosting 2 important events this weekend. The first one will be at Iglesia Ascension. This is on Saturday, September the 19th, from 8 a.m. until 1 p.m. The address is 3680 Rammel Road here in Memphis, 38128. This information will also be available on social media through Latino Memphis and the Health Department. The second event will be Sunday at September the 20th from 1 to 4 p.m. And this will take place at Sacred Heart, 1324 Jefferson Avenue. And this is going to be taking place at the basement of the church. You know, what I want to mention some things that are common for both events. Both events obviously are open to the public. They are free. If you feel that you need to get tested, you are welcome to come. There is a capacity, so there are 150 tests available for each event. So 150 for Saturday and 150 for Sunday. Masks will be provided. This is a walkthrough event. Obviously, social distancing will be enforced. We are expecting for people to be tested only if you are over 13 years old. And I want to mention something that is really important. For all this testing, it's crucial that people provide adequate or the correct name and address and 2 phone numbers. And the reason being is because the results are not available immediately. The results are available within 1 to 2 days. 2 to 3 days. So the health department needs to be able to access you and to reach you to provide you with your results. So it's important that everybody brings some kind of identification, also 2 phone numbers and their home address. You know, as always, people can call the health department or can reach out to Latino Memphis for additional information. There will be bilingual volunteers and staff available to support the community. And now I will say that in Spanish. So, great. Bueno, gracias. Bienvenidos a todos y felicidades por el inicio del mes de la hispanidad. Estamos muy orgullosos que el Departamento de Salud estará ofreciendo 2 oportunidades para que la gente se haga el examen del COVID-19. Ambos eventos son gratis, abiertos al público, y uno tomará lugar este sábado, septiembre 19, de las 8 de la mañana a la 1 de la tarde en la Iglesia Ascensión, en la dirección 3680 Rammel. El segundo evento tomará lugar en la Iglesia del Sagrado Corazón el domingo 20 de la 1 a las 4 de la tarde. Esta información la podrán encontrar en las redes sociales, tanto del Departamento de Salud como de Latino Memphis. Solamente existen 150 pruebas disponibles para cada evento, para un total de 300 exámenes que se repartirán en ambos días. Uno tiene que tener por lo menos 13 años de edad para recibir la prueba. Es muy importante que sepan ustedes que su privacidad permanecerá en alta confidencialidad. Sin embargo, el Departamento de Salud necesita saber su nombre, su dirección y su teléfono para que ellos puedan contactarlo de 2 a 3 días después con los resultados de la prueba. De no tener la información correcta, no podrán contactarlo y entonces no tendrá sentido hacerse el examen. A todas las personas que vienen se les regalarán también máscaras. Este es un evento no en el auto, será caminando, y pedimos a todo el mundo que mantenga su distancia social. Habrá personal bilingüe que atienda en esos días y, repito, la información estará disponible en las redes sociales tanto del Departamento de Salud como de Latino Memphis. Muchas gracias y esperamos verlos ahí.
Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the Health Officer for Shelby County Health Department. I want to just mention a few things before we open up for questions. First thing I want to just mention that due to the 7 and 14-day downward trend in our data, we will be making some revisions to the health directive either the end of this week or first part of next week. We're monitoring the data closely to make sure we're not experiencing an uptick. One thing I do want to say is, though, as we open up things, there still would be restrictions. We're not opening up things to the point where people will be able to gather and function and operate prior to the closure or shutdown. But we will, if data allows us to do so, we'll allow some things to open. However, with that, increased enforcement will be critical. In the health directive, we will be very specific in terms of the safety measures that we are requiring individuals, businesses, and services to adhere to. And our enforcement team will be evaluating and assessing your particular facility or establishment according to those safety measures in the health directive. Therefore, it is very important that you have a copy of the health directive, that you make sure that you are operating in accordance with it. The other thing that I want to mention, there's been a lot of talk about contact tracing. It's my understanding that actually some businesses have hired private entities to conduct contact tracing on their behalf. I want to reiterate and emphasize that it is the health department's authority and responsibility to perform case investigation and subsequent contact tracing. It is a responsibility that is given by law, state laws in the statute that specifically says it is the health officer who's ultimately responsible for contact case investigation, contact tracing, subsequently placing in isolation those who are infected or suspected to be infected, and those who are exposed, that they are placed in quarantine. So the health department takes this responsibility very seriously. We're committed to it. We are encouraging employers, municipalities, and other entities to work with us in collaboration, but understand that it is our ultimate responsibility. We must take the lead, and that your involvement, your decision to hire some private entity to do contact tracing within your particular facility or business does not substitute your requirement to report cases to us as outlined in the health directive, and it also is not a substitute for our involvement and our authority. I've also received some calls, emails concerning playgrounds. I just want to mention that in the Health Directive number 11, there's no mention of playgrounds being closed. The Health Directive is very clear in listing those facilities, businesses, and services that are closed, and all others that are not listed as businesses, facilities that should be closed are open. So playgrounds that are closed, they're closed because municipalities and parks have decided among themselves and taken it on to close them themselves. But the health directive or the health department did not close them. Last thing I want to remind everyone is flu season is rapidly upon us. We encourage you to get your flu shot. Get it early, get it out of the way, because we really want as many people protected for the flu as we can get. With that, I will stop and will entertain any questions that you may have.
Greg Hurst, WREG.
Dr. Randolph, how are you?
Fine, and you?
Doing well, thank you very much. I had noticed today that in your reporting there were 35 resident infections and 2 COVID deaths at Graceland Rehab and Nursing. And now the state is reporting as of October 1st, it will no longer pay for COVID testing at nursing homes. Is that going to put an undue burden on those facilities and our most vulnerable residents?
Well, the reasoning behind the change as it relates to the state, I'm not sure and can't really speak to that. Certainly, the nursing facilities still be required and encouraged to test residents and their staff on a frequent basis. How frequently will be determined. Whether that will lead to increased economic barrier or hardship, I cannot answer. I do not know the financial status of nursing homes, and that's just may become part of the expense of doing business.
And do you think that will impact the senior care facilities and their ability to care for our elderly residents? And should we expect a spike in those cases, do you think?
Well, we're not anticipating that it will affect the ability to care for our more vulnerable population, and we're not anticipating a spike. We'll just have to monitor it and make sure that those nursing home and chronic care providers do the right thing and continue to test.
Jenny DePrizio, Local 24.
Yeah, a couple questions. I have two, one and one follow. The U of M cluster, you had mentioned there's two, one's the football team, you know of. Is the other connected to a dorm, or what is the second cluster?
I will let Mr. Sweat speak to that.
As I mentioned earlier, this investigation is still ongoing, but what we know is that one of the clusters is associated with the football team. One of the clusters is associated with a different group of students, not associated with place of residence, but it's more another group of students, and they share activities and training together, but they have some of the people in that cluster have no connection whatsoever to the football team. So it's still under investigation. We're still building the social networks and ties between the various students as we conduct and staff as we conduct the investigation. I can confirm the football team. I can confirm there's another cluster that we're investigating, but no, I cannot name a specific residential place or something that would define that other cluster of students, but it is still under investigation.
Is it a different sports team?
Excuse me?
Is it a different sports team?
Well, like I said, that investigation is still gathering data, and so we're still trying to build it out and understand it. So I'm not prepared to comment on it just yet, just to know that it's another cluster of students who aren't part of the football team and don't seem to be fully connected to that cluster. So it's a separate cluster under investigation. I really can't share any more than that at this time, but when we can, we will.
Okay, and then the next question is, what restrictions might be loosened that Dr. Randolph was talking about?
I received numerous calls from limited service restaurants. And I just want to tell the owners, I hear you, I understand the sacrifice that you've made, and we will address that in some form or fashion. But understand that things will not go back to the way they were prior to closure. It's very likely that all restaurants, whether you're full service or limited service, will be held to the same requirements as it relates to safety measures and how you operate. So more to come based on the data that we get the rest of this week.
Kendall Downing, WMC.
Hey everyone, my first question is about yesterday Director Haushalter told Shelby County Commissioners that in-person learning may be something that I would assume SCS could reconsider going into the first of the year. Is that because of the trends that you all are seeing? Do you have anything additionally to offer on that? I know that you all don't make those decisions, but you do offer expert advice. And then I have a follow-up.
Well, of course, with the downward trend of data, the positivity rate continues to drop, transmission rate continues to drop, suggesting that community spread is decreasing, then the risk certainly decreases, and the opportunity to do in-person type of schools and training education increases. So the decision, of course, would be one that the Shelby County School would have to make on their own after assessing not only the data and the risk, but whether or not they can achieve in-person schooling in a safe manner.
Thank you. And then my follow-up is about Labor Day. I know David kind of mentioned it. I guess this week would be the week where you would see the increases, if you were going to see more increases from the holiday. Just tell us what you'll be watching throughout the week. Thank you.
Yes. So I'm going to let David speak to that in a minute, but just in general, yes, this is the crucial week because the incubation period of the virus is 14 days. And so this week we will be following things closely as we anticipate some revisions in the health directive. I'll let Mr. Sweat add to whatever he wants to on that.
Yes, I agree with Dr. Randolph. This is the crucial week, at least as far as evaluating the impact of Labor Day. We are now 1 week out, and we know the normal incubation period for COVID virus is 5 to 7 days, but it can be out to 14 days. So now that we're 7+ days away from Labor Day, this would be the week that we would begin to see an increase if there is going to be an increase occur. The reason we're worried about that is following the 4th of July, we saw a large upsurge in cases. And in fact, the month of July represented the high water mark of our epidemic so far. Now, we're watching four things. First is reproductive rate of the virus. Does it stay below 1 or does it go back above 1? That's the first. And we did see that we had been running around 0.82 to 0.85, and now we're up to 0.94. So that is a measure of increase, but we approached 0.94, 0.95 once before recently and then saw it decline. So, we'll be recalculating that by the end of the week, and we'll know whether we went above the 1 threshold or we stayed below. So that's one of the things we're watching this week. The other is the number of cases reported. We've been averaging 121 over the past 7 days, but we had 213 yesterday. If we have multiple days this week with 200 or more cases, that would be a departure from the prior downward trend. On Sunday, we saw an increase in hospitalizations by about 20 some odd individuals. We also saw an increase in the intensive care unit. So both the hospitalizations overall and the ICU hospitalizations had been on a downward trend, and then Sunday they both went up. So that's the other thing we'll be watching this week, is what's going on in our intensive care units, what's going on in our acute care bed hospitalizations, and then, as I said, the case counts overall, and the RT level, and then the positivity rate as well. That's something that we always monitor. So those are the kinds of things we're monitoring right now. Yesterday was the first data point, but by Friday we'll know more whether any of these upticks that we saw on Sunday and Monday were just a blip on the radar and then the downward trend resumed, or if they were the beginning of some new trend. And it's only going to take more data coming in to know the difference.
Sam Hardiman, Commercial Appeal.
Hi. My first question is about the U of M clusters. Could you specify how many cases are related to each of the 2 clusters? And then you also mentioned that there are some unrelated cases among the 36 that not related to the 2. Could you provide a breakdown?
At some point we will. I'm not able to do that right now because the case investigators are still working on it. But as I walked over here today, the update I have is we have 36 students and staff. I can't tell you off the top of my head how many are students and how many are staff, but we have 36 laboratory confirmed cases associated with U of M, and the investigators, the contact tracers, the epidemiologists that looks at the data with the cluster team, they're all still gathering and analyzing that data. So at some point we'll be able to comment more, but right now I can't.
And my second is a follow-up for Dr. Randolph. Dr. Randolph, you mentioned the private sector trying to employ testing and contact tracing. If the private sector provided the health department data from their own contact tracing investigations, how would the health department use that data?
Well, let me just say that employers have an obligation to ensure that their workplace is safe and helpful to their employers, their workers. That's part of the general duty clause under the Occupational Safety and Health Act. So they have an obligation, if someone is infected, that they should identify who may have been exposed, and can and should restrict those individuals who are infected or exposed from working in the workplace. That's within the health directive, spells that out. What we are expecting, and typically what should happen, is that once we are notified of a case or know of a case, that we will contact the employer and seek additional information, names of perhaps other workers who have been exposed, as well as contact information. By the way, I would say that and remind employers that the health director requires them to report to us individuals who are infected or who have been exposed. And so with that contact information, we will indeed contact those cases as well as those who are in contact to place those in isolation who needs to be in isolation. Those who need to be in quarantine will be placed in quarantine. Now, one of the things I want to say is that when an employer tells a worker to go home, what they should tell them is to go home and self-isolate or self-quarantine. The terms, the official term of isolation and quarantine are legal terms in which the health department imposes upon an individual. So you just need to remember that you telling your employee to go home and to, quote, isolate or quarantine is not legally binding, as it would be if the health department has issued a directive or order for that person to be at home in isolation or quarantine. I hope that answered your question.
We are out of time. Are there any closing messages?
My closing message to the citizens of Shelby County: we've come a long way. Let's continue doing what we've been doing to get to this point. Things are headed downward. Let's continue with the face mask and the face covering, the social distancing, washing our hands, using hand sanitizer, cleaning and disinfecting, and avoiding the crowds. So now, as we open up, it is very crucial that we do not abandon the things that got us to this point. We do not want to go back. We want to continue to make progress. And so I'm asking, urging, begging you to still maintain social distancing. You can't just be crowded up like we used to do in various venues. Wear your mask at all times unless you're eating or drinking. Maintain the 6 feet or more, and do all the other things that's necessary for us to continue to function and have some normalcy of life. Thank you, and be safe.
Thanks, everyone.